This is the Get Global Young Professionals Talk Global Health podcast, envisioned and created by the Irish Global Health Network and their student outreach team. I am your host, Megan Davis, Communications and Events Intern at the Irish Global Health Network and second-year medical student at the Royal College of Surgeons in Ireland. In this series, join me and my student outreach team co-host Aidan Desjardins, a microbiology student at Trinity College, as we talk to inspiring young professionals leading the charge in their respective fields, often operating in sidelines to their career, following their passions above all.
Today we are excited to speak to Glenn Curtin. Here's a segment from our conversation.
When you look at kind of these design thinking principles and theories, it all starts with empathy. And if we can actually look at whether it's the patients, the nurses, the doctors, or any stakeholder in healthcare, if we can empathize with the person experiencing a problem, that's half of the job done.
Glenn Curtin is a 23-year-old final year medical student and Quercus UCC active citizenship scholar. He has been involved in leadership and management roles since his early teens, performing a number of community action projects. Since starting medicine at UCC in 2017, Glenn represented Ireland as delegate lead of medical students from UCC, NUI Galway, and UCD to the International Federation of Medical Students Association's 69th General Assembly in Kigali, Rwanda, to advocate for greater health equity worldwide. At the onset of the COVID-19 pandemic, Glenn created Vampire Cup, a national blood donor recruitment strategy that gets young adults donating blood and saving lives through an intervarsity competition. Welcome to the podcast, Glenn.
Thank you, Aidan. Thank you for having me. And hello, Megan.
So we would like to start the podcast just by hearing your story. So would you mind elaborating on how you first became involved in community action projects and your journey since?
Sure. So as you said in the introduction there, I've been involved in leadership and management roles since I was 14 or 15. And I've always kind of been interested in volunteering and kind of being an active citizen. But I often found that I wasn't really taken very seriously as a 14 or 15-year-old. I then eventually became a member of Froga. And Froga is a youth organisation in Ireland. And it's basically that safe space for people that aren't interested in sports, that want to be active citizens in their communities. Through Froga, I then underwent a Leadership for Life course. And this course was spread over, I think, 2 years. And I can safely say that it absolutely changed my life. I did 3 modules of that course with, I think, about 10 other 14, 15, 16-year-olds. I ended up going to NUI Maynooth to an international leadership conference, met some people from New York, Japan, and all over the world there, and eventually graduated from NUI Galway with a foundation certificate in youth leadership and community action. This was my validation then that I could actually do the things that I wanted to. I could be an active citizen because I had that behind me and people would take me a bit more seriously. So that then started a whole journey of getting involved in youth councils and unions and college societies, and then eventually setting up Vampire Cup.
Where did your idea for Vampire Cup originate from? And can you share how you took the idea and turned it into reality?
The idea came from my trip to Kigali in Rwanda, and that happened the start of March 2020. So I actually left Dublin at the start of March in 2020, went to Kigali, Rwanda, a different world, and then I landed back in Dublin to a different world because we went into lockdown the day after. So it was a beautiful experience, but it was crazy. And while I was in Kigali, Rwanda, I met over 100 medical students from all over the world. And what they do there is they have an activities fair where you showcase the different activities that each group of medical students has done. And I met a group from Australia, and they did this really cool thing among their group of medical students where they basically had an internal competition in their medical student body to see which college donates the most blood, and they called it the Vampire Cup. It was just a way of entertaining medical students during their journey through medical school. But I could kind of see that there was some huge potential in it. And I've always been a very passionate blood donor. It's kind of a coming of age thing in our house. My parents are blood donors, and I'm pretty sure my little sister will be a blood donor when she turns 18. And we're very lucky to be able to do that. So I saw huge potential in this idea. And I asked them if they would support me in sending up here, halfway across the world. And they did, and they were fantastic to me. They told me to take the idea and run with it. And I did. I realised that Ireland had very similar problems to what Australia had before Vampire Cup. Only 1 in 4 of us would require a blood transfusion at some point in our lives. But only 3% of the eligible population donates blood. So Vampire Cup sets out to change this by facilitating the creation of thousands of lifelong donors each academic year.
Fantastic stuff there. How do you think international collaborations and knowledge sharing programs, like you mentioned there, could benefit youth and global health work?
I think when you try to be active in your community, when you're an active citizen, you become really passionate about the things you do. And as I'm sure Aidan and Megan, you're the exact same. You get very passionate about the things you're working on. And it's very easy to work yourself into a bubble where the problems that you're identified with, the thing that you're working on, become the biggest things in the world. And even if they're not international knowledge sharing programs, even if it's just a Zoom chat like this, where there's 3 of us on the call, and you actually just kind of vocalize the problems that you're having at the moment or the ideas that you have, and you can trust the other person to say, that is a good idea. This is a similar problem to what we solved through our solution. And it's like a beehive kind of in your head where there's ideas bouncing around and getting changed at each time they meet a different turning point. You also pick up some fantastic mentors and followers and the most amazing people that really do change the direction of your advocacy. So I think for global health, for things like public health, sexual and reproductive health, there's so much creativity and I think mentorship and leadership in these kind of international knowledge sharing networks. So I'd encourage anyone interested in the field to get involved.
Thank you for sharing that powerful imagery. Definitely everyone can make a difference, even if it's just through a conversation like this. Ideas could spread so far. And what do you think the biggest things you've learned in creating a nonprofit organization while also studying medicine full time?
I learned that my time is limited, and I probably learned that the hard way. But there's a couple of things I've learned. I think the first thing I learned when I was setting up Vampire Cup while studying medicine full time was that qualifications are still really, really valued in advocacy. People don't listen to you unless you have a qualification, which is really sad. And I think it really disadvantages young people. But on the opposite side of that, people are so willing to help you if you ask for it. So what happened at the start was I had this fantastic idea for a blood donor recruitment strategy. And I took it straight to my stakeholder that I wanted to be involved and I wanted to help. And they didn't want it. I was absolutely heartbroken because I was so passionate about it. But the fact of the matter is that I was just a medical student in 3rd year with an idea, and that's all it was. It was an idea. So it was one of my mentors actually in UCC told me to get a bit of validity. And to do that, what I did was I reached out to some of my lecturers and I did that whole beehive thing where I just bounced an idea off them, got feedback. And surprisingly enough, a lot of them said, this is a good idea. And it was through my lecturers kind of giving me feedback. And now it wasn't all positive. Some people did have constructive criticism, which is great. And that's what's made Vampire Cup what it is today. But through those interactions with my lecturers, I was able to develop an idea into actually like a problem solution. And I was eventually able to work my way into the Irish Blood Transfusion Service for them to actually take me seriously. So I think that was one thing I learned, that people are so willing to help. And most of those people that have helped me have become my mentors, and they've formed the board that I've created for the organization as well. So they're an ongoing mentor that I go to whenever I have an issue. I think the third thing I probably learned, so the second thing was about mentors, and the third thing was the difference between a problem and a solution. And I think originally when I presented Vampire Cup, it was a solution to a problem that I hadn't fully identified yet. And how I learned this was through Social Entrepreneurs Ireland, who I do have to give an honourable mention to because they were fantastic in helping me. They helped me to identify the problem that I was trying to solve. And when you do get into advocacy like this, when you do kind of start to innovate, imposter syndrome is rife. And it's the same in medicine. and it's probably the same in global health, because there's such big systemic issues that we're trying to solve to create greater health equity. It's impossible not to feel inadequate. So what Social Entrepreneurs Ireland did is they helped me to realize that while my solution might not be the right solution, it's there, it exists because a problem exists. And while my solution may change, the problem will stay the same. And that's what keeps me going. So Social Entrepreneurs Ireland definitely deserves an honorable mention. And that brings me to the fourth thing I learned, which was the available supports for young people like us that don't have the most impressive qualifications in the world and who might be a bit clueless in setting up an organization. There are so many supports there if you just be vulnerable and ask for them.
Fantastic perspective there. What do you think that you find the biggest drawbacks for students trying to create their own social enterprises and trying to work to enact change?
I think you could probably divide barriers to setting up solutions to enact change into individual and systemic. And I think the biggest individual barrier to influencing change is a lack of confidence. And I think that happens a lot with young people, especially students, especially when we're kind of in college training to be something and you're not that something yet. There's often a lack of confidence there, thinking that I have to wait until I'm qualified to make an impact. Then the systemic barriers are probably the fact that maybe we as a system don't have faith in young people. We don't put that confidence in them. We don't empower them enough to actually innovate and to create impact. I think there's a huge narrative, especially in Ireland, that higher education is the way to go after you turn 18. And I think that narrative creates a lot of passive participants in their education. And what we want as young people, as active citizens, as kind of influencers of change, is we want active participants in education. I think higher education in Ireland, for the most part, is a great environment for teaching. But what we need to strive for is a better kind of ecosystem for learning, where we engage all stakeholders, students, staff, volunteers, community organizations, health systems, etc., that we can actually identify an individual learner's strong points and weak points and tailor their education to them by giving them supports and opportunities to take control of their own education. And I think the last thing is, like, students and young people probably lack the training for leadership management skills. Some people have it naturally, but might lack that confidence. So I think providing some training to young people in leadership management and just simple tools that they can use to get an idea up and running would be a fantastic resource. But unfortunately, they're not provided, and they're not as held in high regard as kind of academic competencies in higher education. So I think that's a barrier as well.
What are some strategies that you think of that could help change the narrative around young adults?
I think a lot of it has to do with probably like media coverage of college graduates, and like we put a lot of value in how much each secondary school, how many students go to university, and that's how we determine a school's success. But as an example, there's an education or a school centre here in Cork on the north side of Cork called the Life Centre, and their definition of success varies depending on each student, which I think is the way to go. And they have definitely influenced my vision for what education should look like. And in terms of strategies, I think giving students the information, the opportunity, and the supports to innovate is a fantastic way to engage them in their learning. And this doesn't have to be big things. This could be creating like a mentorship program, kind of looking back to what you were like in the first year of higher education and thinking, what did the Glenn back then need then? And creating an opportunity for students to actually come up with those ideas, be creative, bounce those ideas off each other, create those knowledge networks where students feel comfortable putting an idea out there and having people join them in creating a solution to the problem they've identified.
Why do you think student engagement in healthcare is so important?
I think student engagement in healthcare especially, I think, is extremely important because first, I'll start with the problem. I think healthcare specifically, Ireland has the highest number of medical graduates relative to population in the world. We are number one, and we're twice the EU average, but we have the second highest rate of importing foreignly trained doctors to work in our health service. We're hemorrhaging skilled young people to whatever countries they go to, but they don't stay in Ireland. And I can see that being a final year medical student. I can see the pathway to that. And I can safely say that I am probably on that pathway. I feel as much as I've tried to actively engage in my education, it has been met with a brick wall. And it's very difficult to maintain that level of passion and enthusiasm. So most students don't maintain that level of passion and enthusiasm. They become those passive participants in education, and they end up just becoming a cog in the wheel and emigrating to somewhere where they can more actively engage in their education or in their workplace. And healthcare especially, I suppose, your workplace is your education setting. So wherever you're working, you're learning, and the training kind of never stops. So unfortunately, I think healthcare especially, we need more engagement. Healthcare students need to be able to empathize with the people that they're treating. And that's how solutions start. When you look at kind of these design thinking principles and theories, it all starts with empathy. And if we can actually look at whether it's the patients, the nurses, the doctors, or any stakeholder in healthcare, if we can empathize with the person experiencing a problem, that's half of the job done in innovating a solution. So I think actively engaging students in healthcare is the way to do that.
Would you mind sharing some of your experience about advocating for health equity globally?
I have always been passionate about the inequities around me. And I think this started when I was, 10 years old, because I remember saying it to my mom, saying about what if kind of the answers to a lot of the world's problems are possessed by people that either can't afford an education, can't access it, and they don't have that validation. People don't listen to them because they don't have that validity. I've always been passionate about it. And this is one of the main reasons why I wanted to study medicine. And I kind of decided when I was 12 years old, I was one of those weirdos that did know from a very young age that this is what I wanted to do. And it was an extremely tough road. There was a lot of tears, there was a lot of stress. But I got in. And I realized straight away that medicine was a bit different to what I had anticipated it might be. And I think this was because there was a lot of emphasis on disease and not a lot of emphasis on these systematic issues that impact patients, whether it's kind of poverty, famine, kind of sexual and reproductive health and rights. We didn't learn about them at all. And this was something that I thought was crazy. Then in first year, I came across a group of medical students that kind of felt the same. And they weren't all necessarily from my university. They comprised the Association of Medical Students Ireland. And that was the first time that I felt I belonged there. These were a group of, I reckon, probably 40 medical students from each of the 6 or 7 medical schools on the island of Ireland, all advocating for issues relative to public health, medical education, human rights and peace, and sexual and reproductive health. And as I said, these were my tribe. These were people I felt I belonged to. And that was the start of me advocating for health equity. First year of medicine, I joined the local society in UCC. Then second year came along, and I stayed in this society, not really knowing what health equity was. I knew I was passionate about this stuff, and I knew I wanted to make a difference, and I knew there was something about this organization that would allow me to do that. And I stuck it out. And then in third year, I decided to chair the UCC branch. And that's when I kind of realized that there was so much potential for this, that medical students did not know, they weren't taught about these issues. And it was very difficult to explain these kind of abstract topics to people without a foundational knowledge in the inequities, whether it's in our society, locally, nationally, or internationally in the global south. I think there's huge potential for whether it's peer-to-peer education or institutional education in inequity. And this is where I have been focusing on. What I've done so far is, as you said at the start, Aidan, I set up Vampire Cup at the start of the COVID pandemic. And the reason why I did this, because this is what I saw as a national example of advocating for health equity. Vampire Cup is a blood donor recruitment strategy, and that's what it is primarily. I want people to feel like they have the opportunity, the information, and the advocacy to become blood donors. But there is huge discrimination in Ireland between people that can donate blood and people that can't. And I understand that some of it is science-based, but gay men especially, or men who have sex with men, are very much discriminated against. And this is something I'm really passionate about. So this was a national example for me to show what health equity is, how we can advocate for it, and how innovation can get us there. While I was setting up Vampire Cup, I produced a policy with the International Federation of Medical Students Association. And the title of this policy document was Meaningful Youth Engagement in Medical Education. So while I was trying to walk the walk, I was also trying to talk the talk in the background and produce this policy that I could basically bring a piece of paper to a school of medicine board meeting and say, this is what we want, and this is how we can do it. So I feel that my experience over the past couple of years has shaped where I am today, and it's going to shape where I'll be for the next couple of years, because this is something I'm really passionate about.
What do you think your main takeaways are from getting involved in healthcare action projects?
I think I'd like to go back to my time in Social Entrepreneurs Ireland to answer this question. And I think one of my mentors, his name is James, and he's been absolutely fantastic to me. He is the reason why I'm continuing with Vampire Cup. He filled me with inspiration and motivation. And he told me the difference between an entrepreneur and a social entrepreneur. And the way he defined it was, an entrepreneur is a person that has passion and takes action. But a social entrepreneur is a person that has passion and compassion and takes action. So the main thing I've learned from getting involved in all these kind of health promotion projects is that it starts with empathy. And in my time in Social Entrepreneurs Ireland, I also met a fantastic storyteller. Her name was Claire, and had also become another mentor of mine. And she told me the power of a story. If you can tell a good story about your problem and your solution, you can influence anyone to be a part of it. That starts with empathy. You need to know who's listening to your story, so you can tailor the story to get them in.
So thank you so much for coming on our podcast, Glenn. It was such an inspiring project that you talked about, and I really admire your passion and your perseverance. And audience, if you would like to learn about the Vampire Cup Ireland, please visit their Instagram at vampirecup.ie and their website vampirecup.ie. If you would like to learn more about the Irish Global Health Network or the Student Outreach Team, visit www.globalhealth.ie, where you can sign up for our newsletters. Thanks again for tuning in.